Yeah, I think you have to realize that the chronically homeless make up about 15% of the overall homeless population. Okay, and despite the fact it's only 15%, they actually utilize over 50% of all the resources dedicated to the homeless. It's extraordinarily expensive to maintain a person while they're on the street, when in fact what we found that through the Housing First model is that it actually costs less to maintain them in housing, and that's including a housing subsidy and the supported services, than it would be to leave them on the street. You know, these are folks who have multiple and complex needs: substance abuse issues, mental health issues, trauma issues. Many have untreated medical problems, and nearly all of them have some sort of criminal justice involvement. As a result of that, they're not eligible for publicly supported housing. Housing First has a very simple premise, which is you take somebody who is chronically homeless and house them. And the results are actually remarkable. Prior to entering the program, folks were homeless for over 300 days the previous year before coming into the program, and off and on homeless for 7 years. After entering the program, 87% were still housed after 12 months. And then after 24 months, it's 85%, and after 36 months, 83%. So over 8 in 10 are still housed after 3 years. But what's absolutely critical is that we make available to them other services that they may need. Services are voluntary, so it's not a requirement of them maintaining their housing, but it is available. And we spend a lot of time getting to know the individual, engaging with them, and getting them to articulate what it is they need, what they want, and develop their own goals. And then we've got the professional staff available to help them meet those goals. We're a world that's driven right now on evidence-based practices. Whatever the funding source, they want the data that demonstrates that the programs are indeed effective. The basic results that we're looking for are pretty straightforward. A person is maintaining their housing for how long? A person is utilizing utilizing health services in the most efficient manner. So fairly straightforward outcomes that we're able to measure, and as a result of it, we're able to produce the data that has been able to be the backbone of all the funding support that we've received over the years. The Rhode Island Foundation has been a great supporter of us. Early on, they saw the value of this approach, and they saw the value of the evidence that we provided that the approach was effective. The homeless just need 3 things: a roof over their head, 3 square meals, and a date on Saturday night. They have the same needs, wants, and desires as everybody else. Yes, they want to be productive. Yes, they want family. They want relationships. And what they lack is the opportunity to develop all those areas.